Okay, welcome to Insurance Smart. I am really glad y'all are here. It is open enrollment season, and insurance is very confusing and difficult to use for folks who haven't, learned the basics about it. So, what me and Leighton are hoping is that by attending this program, you'll be able to use insurance to the best of your advantage. It's less than ideal how we have our system right now, but this is how you could do the best you can with what we've got. So first I'm going to introduce myself and Leighton will as well. I'm Kim Adamski. I'm a licensed community health worker and I also have an educational background in insurance and public health. I've worked in both the private and nonprofit insurance sectors, so I've kind of seen like both how insurance works on the back end, but also how people interact with insurance especially as folks who need assistance with getting insurance. In addition to that, I'm also a sexual health educator for Circle Care Center, which is the sponsor of this program. And I do a lot of programs for them that way as well. Now, Leighton, can you introduce yourself as well?
Absolutely. Leighton Thomas, I'm Circle Care Center's Director of Operations for both locations, Norwalk and Glastonbury. Currently, I am the patient advocate as well. We at Circle Care Center are committed to, patient first. Bottom line is, I'm there for support to assist patients in advocating and navigating through the difficult insurance landscape. And so that's what we're here to do today is to make it as easy as possible for you to ask questions, make it understandable to the best of our ability. And insurance is very convoluted. It's just that's the bottom line. And so we'll hope that this presentation today will give everybody some insight into the wonderful world of insurance.
Thank you, Leighton.
You're welcome.
All right. So Circle Care Center, the funding organization, is an LGBTQ inclusive healthcare organization. They have locations in Norwalk and Glastonbury right now. They have a lot of services, including primary care. They have PrEP, mental health, reproductive health, gender health. They have a very big office in Norwalk and also their satellite office in Glastonbury. So check them out.
I can add on. We have some women's health now that we're starting to do.
Yeah, that's right. You just got an APRN for that.
Yes, Tess, she's wonderful.
Yeah. All right. So, what is open enrollment? If you have marketplace insurance, you are currently in the open enrollment season for Connecticut. So, that's an annual period where you can sign up for, change, or cancel insurance plans. You may also have open enrollment through your workplace. That can be various times of year, although typically it is towards the end of the year. And there's also open enrollment periods, or special enrollment periods, which I will talk about in a little bit. So Access Health Connecticut, which is Connecticut's insurance marketplace, runs from November through December. So you can sign up for insurance up to December 31st through the marketplace, but if you want coverage that starts on January 1st, which is ideal, you're going to want to make sure you're signed up before December 15th, and that deadline's coming up soon. So that's why we scheduled this program on this day so that folks who are still in need of signing up can get their information before they go to the marketplace. So special enrollment periods, which I just mentioned, those are periods outside of what would be open enrollment being open to anyone, when you have what's called a qualifying life event. So qualifying life events would typically change your insurance coverage or sometimes end it. So marriage, moving, if you lose your job, if you adopt or have a baby, these are all situations when you might get a special enrollment period because you need to change your insurance for a specific reason that is recognized by the marketplace. This also applies to jobs as well. So if you get married or move or whatever during a time that you're employed, then you will also get a special enrollment period. That also happens when you start a job. If you've started a job before that has insurance benefits and they let you enroll in health insurance as you started, that was a special enrollment period. Typically, special enrollment periods are between 30 to 60 days. The one in Connecticut for the marketplace is 60 days, so it runs from November to December. Okay, so how does health insurance work? This is the basics that in order to use health insurance, it's really important to know. And it can be very confusing to understand. But first, the basics. First, you go to the doctor or your APRN or whatever service you're getting. Then, after your visit or procedure, the doctor's office sends the bill to your insurance. So the insurer has a contracted rate with the provider. So say you're getting surgery of some kind. The insurer has told your doctor, we will pay X amount of money for that. So then for some services, the remainder of that bill above what the insurance will pay, you pay as a copay or co-insurance, which I will define shortly. So basically you go to the doctor, insurance pays part of it, you pay part of it after that. Some services are fully covered and you don't have to pay a portion of, and those are preventive services under the Affordable Care Act. So things like vaccines, your yearly checkup, PAP tests, stuff like that covered. Okay, so now I just want to go over a few quick definitions. So there's a few components of insurance. We have a copay. That's when you pay a fixed rate for the cost of care. So regardless of how much the doctor charges your insurer, you still pay the same amount, say $40. Then we have our out-of-pocket maximum. So this is the absolute max amount that you have to pay before insurance covers all services at 100%. Third, we have a health savings account or HSA. This is a pre-tax account that you put money into, usually straight out of your paycheck. That makes it so that you don't have to pay taxes on it, into a designated account for medical spending. Now, since it's pre-tax, that means you functionally get a discount on whatever you're purchasing with the HSA. Okay, so the premium is the amount that you pay each month to have insurance coverage. So kind of like a subscription to the health insurance as a service. The deductible is the amount you have to pay out of pocket before insurance begins to pay. And this is typically between $2,000 and $7,000 depending on the plan. Typically, the higher your premium, the lower your deductible. The deductible doesn't apply to all services. So sometimes mental health, for example, will be a $40 copay regardless. You don't have to pay the full price, even if you haven't met your deductible. And then last, we have co-insurance, and that's when you pay a percentage of the cost of care. So if you go to a doctor and they charge $100 for their service, and your co-insurance is 80/20, that means you pay $20. However, if that same doctor charges $200 for a service, then you're going to pay still 20%, which will be $40. All right, so this is an example of a deductible and out-of-pocket maximum. So this is my deductible and out-of-pocket maximum. And as you can see, I've spent an inordinate amount of money this year, but that's beside the point. So the deductible here, we have $5,000. And for myself and my husband together, we have $10,000 because we each have a $5,000 deductible. Our out-of-pocket maximum, on the other hand, is a little less than double that. So 9,000 for me, 18,000 for the family. And this varies by individual based on the premium. Usually a higher premium means a lower deductible. It depends on, what your work chooses to get you, if that's the case. If you have things like Medicaid, you won't have either of these things. So it is dependent, but this is fairly standard insurance right here. So in-network versus out-of-network. Now, insurers, if you've ever had to call your insurer or your doctor to see if they're in-network, that basically means whether or not your insurance will cover them or cover them adequately. So we're going to talk about the difference between these two things. So this benefits summary, it tells you the difference between in-network and out-of-network care. So for example, if you go to a doctor who is contracted with this insurance plan, you pay a $40 copay for the provider, unless it is your yearly checkup, because that is free. They do not offer out-of-network coverage for primary care physicians under this plan. Same thing with specialists, telemedicine, urgent care, they only cover in-network. The emergency room, on the other hand, they do pay in and out of network. You have a $450 copay either way after the deductible is met. You can find this information. This is only like a little screen cap of the entire benefits summary. I can't fit the whole thing on the screen, but it'll give you a pretty comprehensive list of what's covered in network versus out of network. In order to find if your doctor or provider is in network, you can call the doctor and say, do you take XYZ insurance? Or you could call the insurer and say, what doctors in my area are covered for this particular service? Now, there's a lot of different types of insurance plans. The one that a lot of folks are familiar with that is state insurance is Medicaid. So Medicaid is an insurance that is offered to lower income households. Anyone below 133% of the federal poverty line, which is based on household size, is eligible for Medicaid. So the 2025 federal poverty line is $15,650 for one person. So that is going to change in 2026. They typically raise it every year, but it'll probably be somewhere around there-ish. So Medicaid is free with few to no copays. There are occasionally copays on like premium drugs. They're not very expensive. There's no premium, there's no co-insurance, there's no deductible. It's pretty good insurance. There is limited optical and dental insurance. So typically adults get very sparse optical and dental coverage. Coverage for kids is a lot better in this regard.
I also hear the phrase husky. I have husky that they're referring to Medicaid because Connecticut's the husky state. So
Yeah.
that's another common term, you'll hear people say is I have husky insurance,
Yeah.
which isn't from the state. So I just wanted to point that out. There's so many different, names that people call state insurance, just state insurance. That's another term.
Yeah, different states call their insurance different things.
Right. Also, too, in the state of Connecticut, it's still ongoing. I have seen it through per plans for 2026. Based on that 20,814, the state of Connecticut has offered what it's called a Connecticut covered program. So it's those individuals that do not meet the Medicaid threshold of that amount that we just talked about, the 20,800 and change. But they'll cover you. You get to pick an Anthem Silver or a Connecticut Silver plan. You are responsible for co-pays and deductibles, but your premiums are covered at 100%. So it's those individuals between 20 and around $26,000. If when you go through the Access Health website and you start putting in all your information at the end, there'll be a place that will say you're either eligible for Medicaid or not. Connecticut covered program you might be eligible for if you fall into that range, or just a regular plan. So I just kind of wanted to point that out because that's something new that I've seen the last couple of years that the state of Connecticut has done. They've invested a lot of money in the health insurance industry, and so they're offering this, and you don't get this in a lot of other states.
Yeah. I know New York has a very similar one, but yeah, this is a really good
Okay.
thing for this is a really good thing for folks who are above the poverty line but still have limited income. And it's pretty good. I know a few people who use it and it's not very expensive for them.
Correct.
This is the best insurance I've ever had, and I have the silver. Yeah.
Yep. Yeah,
Nice.
it's really good. Okay, so next we have Medicare. So Medicare we typically think of as being for people 65 and over, but it also covers people who receive disability benefits. So there's several parts, and a very brief summary is Part A is free, and that's hospital coverage. There's no premium. Part B is $206 a month with a $288 deductible, and this will probably go up slightly in 2026. And that covers doctor's visits and outpatient care. So fairly low premium, very low deductible for what we see today, and that's going to be just like your standard health insurance type stuff for regular services. Part C is vision, hearing, and dental. If I recall, that one is optional, right, Leighton? Yeah,
The
yeah.
supplemental plan as
Yeah, but
such.
if you don't get it at age 65, the premium for it will go up per month for every year that you did not get it, that you were
You,
eligible.
actually, they count by month. So in Medicare,
Oh,
yeah. So you can enroll 3 years before your birth date or up to 3 months after your birth date of the age of 65. And then for anyone who does not enroll by this age of 65 will be penalized if they try to enroll in a Part B and D plan in the future. I give an example at the last session, Kim. You probably recall this. I had a patient who came in with his partner. He was like 80 years old on really simplistic medications. He was eligible for 340B through our pharmacy. So the cost of his drugs are pretty inexpensive. So he never had a Part D prescription drug coverage. And I was shocked for his age. So I convinced him and his partner to get a Part D plan. And 3 months later, the partner called me and just thanked me so much, indicating that his significant other had fallen, had a seizure, is on this very expensive medication. And he said we would not have been able to afford it if you didn't push to let us know that. Even though he had to pay a penalty at 80 years old, normally they're like a $30 to $50 monthly premium for the prescription plans. He was paying around 75, 80, but it saved him.
and then Part D, like Leighton said, is prescription drug coverage, and it will pay up to $2,100. So then we have private insurance, and this is what most people have. About 60% of people have this. It's offered by a lot of employers, or you can get it on the marketplace. This year, there was a tax credit program, which meant that the amount of premium that you paid was scaled to your income. But unfortunately, this program is expiring in January because the federal government chose not to renew it. So insurance is unfortunately going to get a lot more expensive for people who do not qualify for Medicaid or covered Connecticut. Um, it's really not an awesome situation, but there isn't much that we can do at this time. I'm just really hoping that our representatives take care of this.
Yeah.
So just be warned that that is a thing that you may encounter. When you select private insurance, you want to check which plans your providers take. And a lot of insurers have searches that you could see who is covered, or you can call them. If you do use marketplace insurance, you can put in the names of your doctors, and it will put little green check marks next to the ones that each plan covers and little X's next to each one that it does not. The same for insurance or for prescription medications, it'll do that. Prescription medications are a little tougher. You have to look at the formulary, and I will show you the formulary shortly. It's a lot of words. All right, so there's a few other types of coverage. One is the Veterans Administration. So the VA is for folks who have served in the military. Some services are free. Some services have a copay or co-insurance. It depends on not only what services they are, but also veterans who have disabilities get better coverage than just veterans who do not have that designation. There's also company self-insurance. So some companies, and you definitely want to check this if you start working someplace, some companies, instead of completely using an insurance company's plan, they will collect the premiums themselves and dole them out to their employees using a network that they essentially rent from an insurance company. Now, a lot of people do fine with these, but it is important to know whether they have carve-outs. So carve-outs are not typically allowed with private insurance plans, but with self-insurance, companies can pretty much do what they want. Like they'll cut out specialty drugs, for example, which are extremely expensive drugs. So that's definitely
Women's
something you
health.
want to. Hmm?
They can come out women. They can cut out women's health if they want.
Yes,
Um,
exactly.
yep.
So it's important to very carefully consider what they cover if they have self-insurance. And again, if the self-insurance would create costs that are too much for you, then you can get a marketplace insurance plan. Then there are also cost share or ministry plans. These are not insurance. These are basically a company that will say, we are not insurance, and they collect a much lower premium than insurance plans do, but they often will severely limit the services you're permitted to get or will not cover services that you needed. And they do end up being very expensive, especially if you have an emergency or an unexpected illness. So I don't really recommend cost share plans. They are very tempting because of the low premiums, but they don't cover a lot.
No, I was just going to mention that those ministry plans, that's where insurers can sell those types of plans outside of the open enrollment period that Kim talked about earlier. So
Oh,
I unfortunately see that sometimes, and they're definitely less expensive, minimal coverage.
So just always very carefully research what plan is being offered, what the restrictions are. If something says we are not insurance, it's probably not insurance. Um, okay, so there's also some benefits that come with some insurance plans that are underutilized, and one of these is transportation. State insurance in particular, they do pay for transportation. They will pay mileage if you drive. They will pay for a driver to come and get you and bring you to your appointment. And that is something that can be done online or by phone, or you could submit a form, which is on the website. HSAs and FSAs, which we did talk about. A lot of times people don't use these. Some of them do have fees associated with them, but typically due to the money being pre-tax, the fees are outweighed by that. Some insurers will pay for all or part of a gym membership. Just note that sometimes you need to prove you went a certain number of times. So you need to go to the gym desk and be like, can you print out all the times that I went or something? But they will pay for it if you do go the number of times they want you to. And then there are sometimes discounts on health products. I know that at one point insurance plans were sometimes covering Fitbits when those were a thing. So if you go onto your insurance website and just like poke around, you might see some underutilized fringe benefits that you didn't even know were there. Sometimes they'll also give you a discount on like they'll lower your premium if you like take a health assessment and don't smoke or something like that. So yeah, take a look at that stuff. Okay, so the big question is how do I know what's covered? There's a lot of different things you might need to look at. I mean, ultimately the answer is when you are in doubt, call the insurer. But obviously, talking on the phone with customer service is not any of our favorite things to do. So there are a few other ways we can check. So, like I said, when in doubt, call the insurer and keep asking to speak to managers until you get the answer you want, because their job is kind of to get rid of you.
You always can call Circle Care Center.
Yes, yeah, you could do that too. Okay, so first of all, you're going to want to look at the formulary, and this is for prescription drugs. So most formularies have several tiers. Tiers are basically categories of drugs, and they're usually based on what they cost, essentially. So tier 0 is any drugs that have to be covered at 100% under healthcare reform. So preventive drugs like birth control is tier 0. Tier 1 is generic drugs. So if your medication just has like the chemical name on it rather than a brand name, it is a generic drug. Tier 2 is their preferred brand name drugs. So sometimes, especially if there is no generic for a particular medication, they will contract with certain brand name drugs and encourage you to use those ones because they are cheaper for the insurer and therefore cheaper for you. Tier 3 will be non-preferred brand name drugs. So that is brand name drugs that they are not contracted with, cost them more, and therefore they will pass some of that cost on to you. And then tier 4 is specialty drugs. And I did briefly mention specialty drugs. Specialty drugs is basically a euphemism for extremely expensive drugs, but they don't want to say that because that sounds bad. So things like cancer treatment, those very expensive like immunosuppressants, that sort of thing. Those are specialty drugs. And a lot of times the drug companies offer assistance programs because the insurance coverage is not good enough for it to be feasible. If you have a specialty drug and the copay is ridiculous, you should call the drug company and ask about their assistance programs because many of them have them and the income limit will be like $200,000 or something like that. So most people will be able to get the assistance.
Specialty drugs usually also require a prior authorization, so there's a little even more to that. because of how expensive they are.
Oh yeah, the worst part about having chronic illness, from what I hear, is having to argue with the insurance company constantly about whether you still have it.
Yeah. I mean, you're on this medication for 4 or 5 years, and then the new year begins, and we submit a PA and they deny it. This person's been stable on this medication for 4 years. Why would you deny? So we have to go through an appeal process, and it usually gets approved.
They'll be like, "Are you sure you still have HIV?"
Right? Yeah. So it's interesting.
Yeah. So the actual formulary, there will always be several different formularies for each insurer because they have all different plans. So the Affordable Care Act list, for example, towards the bottom of the page is all drugs that are required to be covered at 100% under the ACA. Then you have drugs requiring pre-authorization, which is drugs that require that a doctor call and be like, hey, they need this. And then the insurance has to pre-authorize it. Drugs with quantity limits. These are ones that they can only send you so much at once, either because they're extremely expensive or because they are controlled substances with risk for abuse. So on the top of the page, we see a bunch of different kinds of health plans. Plans through Access Health Connecticut is the one that we are going to look at just because those are marketplace insurance and they're pretty standard. But each of these are different types of groups. Like a large group plan, for example, would be for a large employer. So the formulary itself may be 100 pages long. They're very long, but luckily they are PDFs, so you can Control F search them. You do not have to just go through the whole thing. So this is the first page of a formulary for a Connecticut plan. And right here it tells you what the name of the drug is. And then in the second column, it tells you what tier it is. And then it has like little codes for like requirements and stuff, which those are defined towards the end of the document or sometimes on the first page. And those are usually things that doctors will need to take a look at. But these will tell you first if your drug is covered at all by the insurance, and then like how much it's covered. So tier 1 will be cheaper, tier 3 will be more expensive. Usually you want to look it up by the chemical name of the drug, not the brand name, because it will list the chemical name. So then appeals are another thing. So sometimes coverage will be denied, and a lot of times the coverage is just auto-denied. A person didn't even look at it. So when you appeal, that means that a human being will actually look at it. And the provider's office will do the appeal for you because they have paperwork that they have to fill out and explain why you need this specific drug. So for example, if you are a person with depression, and you are taking a more expensive drug for depression, and you've been taking it for a long time, and you've tried whatever the cheaper ones are, I don't know, like Prozac, for example, and it didn't work, your insurer may still deny the drug that you take if you get a new insurance plan, because they're like, oh, have you tried Prozac though? So your doctor will have to go in there and be like, yes, they have tried Prozac, and appeal it. And then if the insurer decides that the reason is good enough, then they will cover the drug. So it's also a good idea to know about tax deductions. This is something I didn't know about until this year. But if your healthcare expenses, which include the premium and mileage that you use to get to and from the doctor, equals out to over 7.5% of your total income, you can subtract or you can write off the excess of 7.5% off of your taxes. So my example here is, say you make $40,000 this year. You paid $5,000 for healthcare out of pocket this year. Now, 7.5% of your income of $40,000 is $3,000. So anything you paid out of pocket in excess of $3,000, you can write it off on your taxes. So that's $2,000 in this case. So this will apply especially to people who have very high premium plans or people who got medical procedures. But some people are just more expensive than others. And if you look at your premiums and your out-of-pocket spending and you compare it to your income, definitely write off what you can, because every little bit helps.
Yeah, Kim, correct me if I'm wrong, but besides the premium and mileage, co-pays, right?
Yeah.
Deductibles, anything. I mean, you have to save those receipts. It's important for tax purposes, but yeah, that all does qualify. You're right.
Yeah, and then the out-of-pocket expenses for like copays and stuff are very easy to find the total for because your insurance will say on the front page, this is how much you paid out of pocket this year. And then you can go to your premium payments and it will tell you this is how much you paid for your premiums. Don't forget to check your dental and optical insurance too.
Point.
Yeah. Okay, so Leighton, let's hear about self-advocacy because that's your thing.
That's my thing. So, with the insurer, if you're not sure what a bill is for, is simply just ask. Um, our patients are great about calling. I had 3 people today that called, and I was able to resolve every single situation. So it's important that you give us a call rather than ignore. We're always here to work with our patients. And if especially if they need some financial assistance, we offer patient assistance at Circle Care Center. Evan, I think I mentioned that to you before, or Shane. But in addition to that, just because you have commercial insurance, some people simply can't afford those high deductibles that Kim was talking about earlier. So hence, we can provide assistance and help out in those areas as well. I mean, it's income based, but it's a pretty high income amount. So please feel free to reach out with that. And it's always important that you call the insurance regarding the information and what you covered for. Know what you're going in for. You're not feeling well, a general office visit, a wellness visit, sick visit. They can give you that information relative to how much it will cost you for that specific service. So it's really important. The insurance company is there. They're supposed to be, you have a contract with the insurance company. We have a contract with the insurance company, but they're still there to help. And so they have specific member services number. We're very blessed in the medical environment. We have specific provider numbers. So generally we get a hold of a rep a lot sooner. So if you ever get frustrated, it's very time consuming. Please give us a call because a headache is not worth it.
Okay, and self-advocacy at the doctor.
The doctor's office. Oh, you opportunity to ask for less expensive medications, drugs, things like that. We're very lucky. We have a Circle Care Center pharmacy attached to Circle Care Center Norwalk, which also services our Glastonbury patients through mail order. And our pharmacists and pharmaceutical techs are phenomenal in looking at that least expensive way to transfer those savings onto our patients.
Again, if you're not sure what the bill is for, you can ask the doctor as well.
Yeah, I think the other important thing is besides statements that you may receive from your provider's office that you had seen, say, in the last 30 to 60 days, you should also be receiving an EOB, an explanation of benefits that comes directly from your insurance carrier. And they're required to send out an EOB relative to each service date that you have with a specific provider. So you should be receiving some type of summary within 30 days of your visit from your insurance company that will state how much they paid, how much you were responsible for, etc. And we have payment plans. We never send our patients to collections. We're here to serve our patients and then make them be the first point of as far as contacts are concerned. So in other words, we have payment plans. We have had worked that out with balances through other patients and stuff like that. But again, we have the patient assistance that we can offer to our patients, and they really, really love it. They love it, and they appreciate it. And we're lucky that we can provide that service to them. But even general doctor's office, if it's not Circle Care Center, they should absolutely work with you with payment plans. You just need to be upfront, be honest with them, tell them, what you can afford, and just be committed to that amount. And as long as you're committed to that amount, they generally will not send you to collections, even if it's a large bill. I've known people that have like a $4,000 bill. All I can afford is 50 a week. It's acceptable. Yes, it's going to take you a while, but You're not paying interest on it. You'll have a payment arrangement. You don't have to put it on a credit card and pay that interest. So most offices I find most doctor's offices will find a way to help you out. But you just need to be upfront, honest, and consistent.
I believe that there's also relatively recent rules that the money that you owe at a healthcare facility, it cannot affect your credit score negatively.
Correct. So July of 24 was that time period that came into effect. And so people's balances, if they have medical balances on their credit report, they're supposed to be wiped, taken off of those reports. As they said, it should not be affecting anyone's credit anymore.
So another thing you might want to do is ask if each individual service is covered by insurance. So I know somebody who has to get special blood work for a chronic illness that they have. And since it's like kind of non-standard blood work, they have to go in there and say, okay, can you look up this code and find out what the copay will be? Can you look up this code and find out what the copay will be? And then they can say, hey, this one's too expensive, I'm not going to get it. Or they could say, this one's so important that I'm still going to pay for it, even though it's expensive.
Of course, we have our insurance navigators. I am the one right now that's doing the navigation for our patients. But insurance navigator, I find many medical practices now have that. They call it a patient navigator or an insurance navigator. And what they're there to do is to help you navigate the insurance world relative to the bills that you receive from your, provider's office, from helping you navigate the enrollment process, which plans to choose for the following year. And so take advantage of those when they're offered because they're free services. They're free services.
And the bigger healthcare companies always have them. So like Hartford Healthcare, Trinity Health, Yale, they all have them. And a lot of smaller ones do as well.
Well, that's good to know.
Yep. Yeah. Some places also have pharmacy navigators specifically for folks with very complicated pharmaceutical needs.
Really? Yeah. Interesting.
Yeah. Okay. So here's a little bit about medical debt. Like I mentioned, as of 2024, medical debt in Connecticut cannot be reported to credit bureaus, and it will not negatively affect your credit score, or should not negatively affect your credit score.
It's going to take some time for that to, I think, fall off. They should be correcting those.
Okay, so I just want to say, I know that this all sounds really tedious. Our medical system is very fragmented right now, and so there's a lot of moving parts, a lot of parts that don't talk to each other. You may have, even providers often don't talk to each other, or it's very difficult for them to do so. But insurance plans all vary. It's a lot for your provider and yourself to keep track of. But it is really, really important to help you access the healthcare you need. If you need healthcare, it can feel really intimidating, but it is also it is important in order to stay healthy. Getting preventive healthcare in particular, which remember is generally free. There are exceptions because for some reason, some random services they decided aren't preventive. Vasectomies come to mind. I don't know how they came to that conclusion, but there are a lot of preventive services that are free and will help maintain your health. So you might not need as much. You may not need to pay as much or get as much procedures down the road. Mm-hmm. And if you do, having insurance is going to really come in handy because even though it's extremely expensive, like I said, it is not as expensive as going to the hospital for a week. So some resources for you. First, we talked about Access Health Connecticut. That is our insurance marketplace. They have a website, which is pretty easy to use. And also you can call them and they will help you sign up for insurance without even having to go on their website. They offer a ton of different plans at different price points. You can get really fancy coverage. You can get really basic coverage. You can also get optical and dental. There's also the Connecticut Office of the Healthcare Advocate. And this is a person whose entire job is to help constituents get people to access healthcare and get insurance coverage and find the care they need. If they're experiencing issues with their healthcare, sometimes the healthcare advocate can help with that. Another program that the state of Connecticut has is the Array RX card. That's relatively new. I actually found out about this because I was at a Pride event and the Connecticut comptroller's assistant came up to me and was like, "Let me tell you about this." So it's basically a very similar thing to GoodRx, and it gives you discounts on certain drugs. GoodRx is also
Do they claim, Kim, does Array RX claim to be better than GoodRx as far as discounts? Just
From
wondering.
what I looked at personally, it was about the same.
Okay.
But I think it might do different medications. It probably just depends on your medication, but it's certainly worth looking into. GoodRx also gives you discounts on drugs. You just go to their website and sign up. It feels kind of weird to go to the pharmacy and be like, actually, I get a discount because I've heard of this website, but I guess that's where we are. And then last, we have the Department of Aging, which also does a lot of healthcare work, insurance work, advocacy, and they can be helpful to reach out to, especially for folks who are seniors.